we will discuss the top 7 causes of hand numbness and tingling. First, we should note that most cases of hand tingling and numbness are not caused by disease, especially in generally healthy people. It can be caused by sleeping in an awkward position or keeping the wrist bent for a prolonged period, which causes pressure on nerves and disrupts blood supply. Additionally, cold exposure can temporarily reduce blood flow. Holding a phone for too long, typing, or gripping objects tightly can also be contributing factors. Such cases account for around 70 to 80% of instances. However, when hand numbness is caused by disease, the first and most common cause is carpal tunnel syndrome. It is responsible for around 30% of hand tingling cases, which is caused by disease. It usually affects one hand, but can also affect both. Carpal tunnel syndrome is caused by median nerve compression in the wrist. People often describe the tingling as a pins and needles sensation, primarily affecting the thumb, index, middle, and part of the ring fingers. A person may experience a loss of sensation and pain, which can radiate to the arm and shoulder. The tingling often worsens at night. Risk factors for carpal tunnel syndrome include repetitive wrist motions, such as typing or using hand tools. These repetitive motions can cause the tendons to swell, increasing pressure within the carpal tunnel, which compresses the nerves. Genetics and other diseases can also play a role, causing nerve damage, fluid retention, and swelling, leading to nerve compression. This compression causes reduced blood flow and ischemia, which results in the numbness sensation. Initial treatment for carpal tunnel syndrome includes wrist splinting, especially at night, to provide a neutral position. For pain, ibuprofen or corticosteroids can be used. Injecting corticosteroids can provide pain relief for several months. Taking breaks from repetitive tasks, changing wrist positions, or using ergonomic tools are also recommended. Exercise and weight management can help as well. Surgery, which involves cutting the transverse carpal ligament to relieve pressure on the median nerve, is highly effective. Around 30% of carpal tunnel syndrome cases resolve on their own. The second most common cause of hand numbness is diabetic neuropathy. It is responsible for around 25% of cases. Constantly elevated levels of glucose damage nerves over time, but it is not the first sign of diabetes. Usually, diabetic neuropathy starts in the feet, but it can also affect the hands. People describe it as a glove-like sensation, where their hands feel as if they are wearing gloves, reducing their ability to feel textures and temperatures. In this case, blood glucose control is the solution to prevent further nerve damage. For localized pain relief, acetaminophen, capsaicin cream, or lidocaine patches can be used. For prolonged and severe pain, antidepressants like amitriptyline and duloxetine can be prescribed. Sometimes, anticonvulsants are also used. Diabetic neuropathy is typically a chronic condition that can worsen over time if blood sugar levels are not well managed, so early diagnosis is crucial. Around 15% of cases are caused by cervical radiculopathy, which means nerve root compression in the cervical spine, often due to a herniated disc or bone spurs. This condition can cause radiating pain, numbness, and weakness from the neck down the arm. The pain usually affects the neck as well, radiating from the neck down the shoulder, arm, and sometimes into the hand and fingers. It typically affects people over 30 and is more common among men. This condition is caused by degenerative changes in the spine due to aging, occupations or activities involving heavy lifting, repetitive neck movements, or prolonged poor posture. X-rays, MRIs, and CT scans can detect degenerative changes, bone spurs, or other structural issues. Treatment can include nonsteroidal anti-inflammatory medications like ibuprofen, naproxen, diclofenac, celecoxib, and meloxicam. Physical therapy is important for strengthening muscles and avoiding activities that exacerbate symptoms, using proper ergonomics. Corticosteroids, either oral or injectable, can reduce inflammation and swelling. If pain persists or worsens despite treatment, surgery may be necessary. The fourth most common cause is ulnar nerve compression, cubital tunnel syndrome, which is caused by compression of the ulnar nerve at the elbow. It results in tingling and pain in the forearm, hand, and fingers, particularly the ring and little fingers. It most commonly affects adults between the ages of 30 and 60 and is more common in men. It is common in occupations that require repeated bending and straightening of the elbow, such as throwing, lifting, or hammering, as well as sports like baseball, tennis, and golf. Treatment includes elbow bracing or splinting, especially at night, to keep the elbow in a straight position, nonsteroidal anti-inflammatory drugs, and surgery if there is no improvement over time. Surgery involves cutting the ligament that forms the roof of the cubital tunnel to relieve pressure. Multiple sclerosis, MS, and vitamin B12 deficiency can also cause tingling in the hands and feet. Vitamin B12 is important for the protection of nerves, and without it, they can be easily damaged. Other causes: peripheral artery disease, rheumatoid arthritis, and other rare neurological diseases can also cause hand tingling, but such cases are rare.